Hair transplant transformation. The journey from being bald to being confident, having a head full of hair. Today's case, which we are going to discuss, shows a wonderful transformation. Let's have a look at the series of pictures from the day of surgery till 1 year after surgery. A quick look. So this is how you can look after a year. But if you want to see how you would look post-surgery, even before undergoing surgery, you can have the help of one of the features of Saraswat Hospital App, which is PeekAI feature. This is the machine learning based AI algorithm which helps you find out आप कैसे दिखोगे after your hair transplant. I'll tell you more about this in the middle of the video, but first let's discuss today's case. My name is Dr. Preeti Saraswat. I'm an American board certified hair transplant surgeon and I work in Saraswat Hospital Agra for past more than a decade and a half. If you haven't subscribed to this channel yet, please do, because we'll be bringing to you many more such testimonial and educational videos, and you can find out so many of them. The patient was 28 years of age with no family history of baldness. So you see that he went up to grade 5 at 21 years of age with no family history of baldness, neither on paternal nor on maternal side. When he came for consultation, first thing first, we did a trichoscopy for him. In the trichoscopic findings, there was density at the donor side, which was good, like it was around 80 grafts per centimeter square. Then the average diameter of individual hairs at donor side was also good. It was around 0.081 millimeters per shaft. The donor area was just sufficient enough to give us the harvest of grafts we required for recipient area. How we knew that? We did the calculations. In the recipient side calculation, we found the area which was to be grafted, and then we could not fulfill very high density in the whole of the area. So what we did, very artistically, for the front and mid, we thought that a density of 35 grafts per centimeter square would be good, and towards the crown we decreased the density a little bit, like up to 30 grafts per centimeter square, so that the area is covered and the density is good enough for the patient to comb his hair when the hair roots come out. If you haven't liked the video till now, please hit the like button, and if you have any questions regarding how we planned for him, or you want to have your hair transplant planned after trichoscopy, do write in the comment section below or call us for appointment on the numbers below. On the day of the surgery, after making a proper hairline designing for him with the laser device, after proper sensitivity testing, after that we took the patient for surgery. For the hair transplant surgery, we make the slits first. After making the slits, we harvested the grafts by FUE method by a very special low torque, low RPM machine. After that, we had our staff which segregated the 1s and 2s, 3s and 4s, and the good ones from the chubby ones and the thin ones in different segregations, and then the patient lied down properly in the supine position and we had our grafts filled in the pre-made slits. He took his necessary washroom breaks and lunch break and tea break in between, and in the evening after finishing the hair transplant procedure, we explained all the post-op medications and do's and don'ts to him. We gave him a packet of medication and then he went home. Now you are seeing his pictures on the third day when he came for a head wash from the front and from the back, also at the donor side. Here on the screen now is his pictures after 3 months of surgery. He then arrived for PRP after 6 months of surgery. See the transformation. These are his pictures after 9 months of surgery, and now you are seeing him after 12 months of surgery. Now have a quick look at his transformation from before surgery till after 12 months of surgery and see how nicely everything has come up. You can see a good growth in the recipient side and you cannot see from where we have taken the grafts. So the donor area looks absolutely normal. If somebody in your family or friends is planning a hair transplant, please share this video with them so that they get to know what they can achieve with proper consultation and treatment planning. planning. Now, as I said in the beginning, if you want to know how you would look after your hair transplant, even before undergoing the surgery, quickly download the Saraswat Hospital app. There are just 3 quick steps. Download the app, click on the PeekAI feature, and upload your pictures. Within 24 to 48 hours, you'll receive your pictures showing how your growth would be there after you get your hair transplant done. Not only this, we'll give you a bunch of questions which you can ask your doctor at the time of consultation so that you get proper understanding of your procedure and you also know what you can ask for. Not only that, we'll tell you approximate number of grafts which would be required for your own surgery. Now, a quick take-home message. First of all, whenever you get your hair transplant done, please see if the place is certified for the hair transplant surgery. Then the doctor you are seeing has proper credentials to do the hair transplant. Not only this, machine which is used should have a counter so that you also know how many grafts have been taken. And the center and the doctors and the team should be skilled enough to handle any possibility, any problem which may come in between. Not to mention, knowledge sharing increases the experience. We at Saraswat Hospital have been training hair transplant to doctors from more than 30 countries, and the doctors have been, I think, more than 90 till now for past 9 years, and so we have a lot of experience to share with. If you want to know about the cost of hair transplant, please click the video on the left, and if you want to see new testimonials of our hair transplant patients, please click the video on the right.